Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Alia Azahra. I am a student from class 4A of English Education Department. So now, in this occasion, I would like to make some side interpretations to fulfill my assignment from Mem Kurnia. So keep on watching and enjoy this video. Pneumonia is an infection of the air sacs in one lungs or both. Infected air sacs can fill with fluid or pus, causing a cough with phlegm, fever, chills, and difficulty breathing. Pneumonia can affect anyone. However, there are certain groups who are very vulnerable to experiencing this problem and getting serious impact to death. These groups are: the first is children under 2 years of age, and the second is parents over the age of 65 years, and the third is smoker. The fourth, people with certain medical conditions such as asthma, cystic fibrosis and liver, kidney or heart problems. And the fifth, people with weakened immune system such as people with the flu, people with HIV or AIDS, undergoing chemotherapy, or taking drugs after an organ transplant. And the last is people who are hospitalized for long periods of time, especially those are assisted breathing apparatus. And people with pneumonia can also experience complications such as pleurisy, lungs abscess, and septicemia. And then the prevention of this disease. The first is cover mouth and nose with a tissue or handkerchief when coughing and sneezing. And the second is immediately throw away the used tissue because the attached germs can survive for a few hours. And the third, wash your hand frequently to avoid transferring germs to other people or objects. Fourth is a healthy lifestyle can also reduce your risk of developing pneumonia, such as not smoking and consuming alcohol. And then symptoms of pneumonia disease. Symptoms of pneumonia is vary depending on the degree of mild to severe infection, the causative organism, and the age and health condition of the sufferer. Mild symptoms resemble those of the flu but last longer. In addition, other symptoms are chest pain when breathing or coughing, confusion or a change in consciousness, and this is usually occurs in people over the age of 60 years. Cough with phlegm, weakness, fever, sweating, chills, body temperature below normal, nausea, vomiting, diarrhea, and shortness of breath. And then cause of pneumonia disease. Pneumonia can be caused by bacteria, viruses, and fungi, and however, these infections are often caused by bacteria and viruses in the air we breathe. Pneumonia can be classified based on the cause of the organism. The first is community-acquired pneumonia, and this is caused by bacteria, especially Streptococcus pneumoniae, bacteria-like organism, fungi, and virus, especially in children under 5 years. And the second is hospital-acquired pneumonia. Hospital-acquired pneumonia is more dangerous because the bacteria that cause it are more resistant to antibiotics. And the third is healthcare-acquired pneumonia. It's a bacterial infection that occurs in people who are hospitalized. And the last is aspiration pneumonia. This is occurred as a result of food, drink, vomit, or saliva that is inhaled and enters the lung. And the last is pneumonia treatment. There are several ways to treatment this disease. The first is take painkiller such as paracetamol or ibuprofen, which can help lower the fever. And the second is don't take cough medicine. Coughing is actually the baddest way of expelling phlegm from the lungs. And the last is quit smoking.